HIV and AIDS Control Programme. AIDS is a life-threatening disease caused by RNA virus called human immunovirus, HIV. Upon entering the host cell, the viral DNA incorporates itself into the host's DNA and utilizes an enzyme called reverse transcriptase to generate complementary DNA. The mode of transmission of HIV from one person to another is through sexual contact with infected person, usage of contaminated needles, transfusion of contaminated blood or other blood products, infected mother to the newborn baby. The first case of HIV was reported in USA in the year 1981. Later in 1986, around 20,000 cases were reported across the world, whereas no case was reported in India till then, but after a year, first case of HIV was diagnosed in Chennai among the sex workers. At present, millions of people are infected with HIV in India, which makes it third highly infected country in the world. National AIDS Committee formed in 1986. In 1987, National AIDS Control Programme, NACP, was initiated, which primarily focused on testing of blood donors and people who were involved in sexual activity with multiple partners. As the implementation of NACP acclaimed success all over the world, the GOVT launched Phase 1 of NACP in 1992 with an International Development Association IDA credit of $84 million. Objectives. The main objective of NACPI was to focus on creating awareness among the people to decelerate the spread of HIV infection, thereby reducing the rate of morbidity and mortality due to AIDS in the country. Later in November 1999, NACP2 was launched with the objective of reducing the spread of HIV infection while increasing the capacity of India to respond to the prevailing cases of HIV/AIDS on long-term scale. National AIDS Prevention and Control Policy was formed in 2002 to monitor high-risk groups, HRGs, such as sex workers, transgenders, TG, and men having sex with men, MSM. The HIV and AIDS Control Program is a national initiative designed to prevent the spread of HIV, provide comprehensive treatment and care for those living with HIV/AIDS, and combat the stigma associated with the disease. The program includes a range of strategies from prevention and education to treatment and support services. Objectives of the HIV and AIDS Control Program: prevent new HIV infections, provide treatment and care, reduce stigma and discrimination, strengthen health systems. Key components of the program: education and awareness, voluntary counseling and testing, VCT, antiretroviral therapy, ART, prevention of mother-to-child transmission, PMTCT, harm reduction support services. Implementation strategies needs assessment, strategic planning, resource, allocation, collaboration and partnerships, monitoring and evaluation. Successes and challenges. Reduction in new infections, increased awareness and effective prevention strategies have contributed to a decline in new HIV infections. Improved health outcomes. Access to ART has significantly improved the health and longevity of people living with HIV. Enhanced support systems. Strengthened community-based support systems have helped reduce stigma and improve the quality of life for those affected by HIV/AIDS. However, the program also faces several challenges. Funding limitations. Adequate funding is critical for the program's sustainability and effectiveness, but it often faces financial constraints. Cultural barriers. Societal beliefs and stigmas can hinder people from seeking testing and treatment. Healthcare infrastructure. Inadequate healthcare facilities and workforce in certain areas pose significant challenges to service delivery.